when I started in 2015, 98% of staff actually could recite the values, which is pretty amazing to have that high recall and recognition of the values. And you already mentioned the staff awards celebration this evening. It's all around the values. When we recruit, we do value-based assessments, we do value-based appraisals. I think we've, over the past 7 years, really built on that great foundation of a strong value-based clinical-led organization. And I just want to have a few reflections on those values because they are real. And for newer staff members that may be in the 2% that couldn't recite the values, I'll give you some tips how you can best memorize the 6 values of the trust. By the way, you see them in the background. Jonathan was talking about the difficult period of the pandemic, and we're still not out of that difficult period. And you see some pictures that have become commonplace in the past years, but also it cites the values. And delivering compassionate excellence is a good sort of catchphrase to at least have 3 of the 6 values in one sentence. And we've really focused on delivery, and I'm very proud that the whole organization focused on delivery. And we have now a lot more people working in the trust than when I started. We had 12,000 full-time equivalents. When I started, we now have 14,000 full-time equivalents. And I mean, it's a large number of people that we have, and they all are focused on making sure that we diagnose and treat as many patients as we can, because there's clearly a very high demand for our services. And we've delivered significant productivity improvements, whether that is in theaters, where we're now operating on more patients in each of the sessions that we staff. We're admitting more patients to the hospital, but with shorter length of stay, or we even don't admit them anymore at all. We can treat them in a day clinic. We've been quite successful in organizing virtual consultations. I mean, all of these are tremendous achievements that we delivered over the past years. I'm very keen, and I think Jonathan referred to that, about the value of compassion. And especially when you have such a difficult period that we just went through, and still the years ahead will be difficult with the recovery from the pandemic. What I feel very strongly about is that we need to be able to listen to our teams and acknowledge some of the problems that they have, try to understand what they are trying to do about the problems, but then also asking what you, in my case, I can do to help my team to deal with some of these challenges. And that is extremely important. It's talking about private work balance. It's talking about difficulties getting to work. It is about everything that we can do to help each other to make the work more feasible. And that is the value of compassion. I think excellence has been demonstrated in the past years, and certainly during the pandemic. The One Team, One OUH approach has really made a difference in Oxfordshire, in Thames Valley, in England, and we could even claim we all made a difference in the world with the staff testing program that we organized. And Katie will join us later with the latest update on the IPC measures, but a lot of the insights were delivered through that staff testing program, and it even informed sort of global, the national guidance. So some amazing things we've done around testing, of course, the recovery trial, the vaccines trials, where a number of our staff members have been participating. And in that sort of excellence, we do that in partnership with the University of Oxford, Brookes University, but also other NHS organizations locally and more broadly across the country, but also with lots of private and voluntary organizations. So the One Team, One OUH approach is really in partnership with lots of people. And I just want to thank once more, and maybe the last time in a staff briefing, I mean, the tremendous efforts that you all have made in collaboration with colleagues across what I often call the ecosystem to deliver this excellent service to our patients is just been tremendous. So you have the first three values, delivering compassionate excellence. The next three, I'll start with respect, because respect is really important. We come from different regions, different countries. I come from Belgium, for those who don't know me yet, if you're a recent joiner of the trust. But we have people coming from across Europe, from Asia, from other parts of the world to make Oxford their home. And we need to make sure that they feel at home when they come to our trust, because we all have different beliefs. We have different colors. We have different preferences. And so we need to be really focusing on the diversity and inclusion agenda, which again yesterday was sort of published in one of the reviews as highly needed. I think we've come a long way. When I joined the trust, the executive team was mostly white and mostly male. I think we have now a good gender and background sort of mix in the executive team. We still have ways to go across the trust to make sure that everybody feels we're representing the community that we serve. But I think diversity makes us stronger, makes us also better. And so let's have respect for different beliefs, different preferences, and people with different colors. I think that is really, really important. The next value is what people often come for the trust, because we're a teaching trust. So it should be easy to remember that learning is one of our values. And when we prepared this last staff briefing, the communication team said, we're very pleased that you embraced new technology, not just in terms of how we care for patients, but also how we communicate with staff, and we had to during the pandemic. And it's not always easy to change the way you work and embrace new technology. We live in a society where continuous learning is what is required. And we tend to do so at home with smartphones and other technologies that have changed the way we live in our private lives, but we also have to do the same in our professional lives. Just embrace new ways of working, new technology, and make sure that we use it in a way that it improves the service we deliver to patients, but also makes our work more workable. And that leads to the last value. We need to learn, because we also not just continuously learning, but also there's a continuous improvement. And improvement is the last value. Again, extremely pleased that we have made significant progress on quality improvement at the trust. We have a very strong quality improvement team supporting the clinical teams to achieve a better service, often use the resources in a different and smarter way so that we can diagnose and treat more patients. And we have lots of quality improvement projects that are led by clinicians across the trust, but also in finance, HR, and other functions that are crucial for the way we operate. And of course, I'm very pleased that Meghana Pandit, who will take over from me on the 1st of July, has been a real champion of quality improvement. So I'm sure that that value will remain in the center focus. Meghana has a real passion around quality improvement, learning, and I'm very confident that I leave the trust in good hands, because the executive team that has been working with me is quite diverse. They come from different parts of the world. They have different colors, different beliefs. We're quite complementary. And we've also been able to appoint a next generation of leaders, both at clinical level as well as at corporate level. So we have a very strong team in place, and I'm sure that we'll go from strength to strength. And it was a real pleasure serving the community here in Oxford. I'm very keen that you guys keep serving the community very well, because I'll stay in Oxford and may become a patient, hopefully not, but may become a patient at some point in time. And extremely proud of everything you've done, and wish you all the best in your next endeavors. And make sure you keep the values at the core of what you do, because it will make you, your teams, and the organization a much stronger organization going forward.